I've become interested in the question of why are there differences in risk of developing myeloma by your genetic ancestry. So in particular, we've got a grant to study African Americans and to understand why they have a threefold excess risk of myeloma. And this is a very real risk, it's a very real feature, and yet we have no idea why it happens. And so we've got a big study aiming to do whole genome sequencing to map the genetic signatures or the mutagraphs that are seen in African Americans and European Americans. But to come back to your question about Hispanics, so in order to understand people's sort of racial origin rather than their ethnicity, which is how you feel about yourself, you have to have a way of doing that at the genetic level. So we've used an admixture tool mapping people's origins to the 1000 Genome Project. And so we wanted to say what happens to Latin or Hispanic Latin Americans. And so we took like 60 plus people from the CoMMpass study and then ran the admixture tool on them. And what we found is that you can find people from Spain. So we found all of the Spanish people in there, all of one kind of pre-standard origin. But in the Hispanic group, there was 30% of them that had African American origins as well. And so what you start to see is that you have European, Hispanic, and African origins. And so surely that affects the risk associated with your racial origin. So what we're trying to do is to be able to dissect out the genetic origin of this excess risk in African Americans and trace it to where it comes. So we're even looking at like kind of, so if you come from Africa, do you come from Ghana, do you come from Senegal, do you come from Angola? And so the idea is to really look into that in depth so as we can really shine a light on this, because I think it is a really substantial problem. Again, that if we understand it, we'll be able to do something about it.